appointment for the patient to come back for their second appointment. At the first appointment, you would have told the patient that to make a full denture takes about 5 appointments, assuming that there are no hiccups in all of our steps. Okay, so now we are off to our second appointment. So Mr. Martin left. Now you see, Mr. Martin, I will call you when the lab gets back. When your special trays get back, then you tell him to come back maybe next week Tuesday, for example. Mr. Martin comes back now for our second appointment. So this is where we take our final impression. So this final impression will still be in our special trays. So in this appointment, impression is taken in a special tray, the special tray that we got back from the lab, using zinc oxide eugenol impression material. So yeah, we use Zoe. So we're gonna mix Zoe, mix. Place the material in the special tray, and then we take our impressions again. The special trays are normally either perforated or not perforated. Sometimes they're underextended. I don't want to go into detail because this is not your scope of work, but sometimes if they're underextended, you may have to add material around your special tray, or the dentist has to add material around the special tray to make it actually adapt better to the patient's oral cavity. Okay, and then from there, impressions are then sent back to the lab. So once we're done taking impressions with our special tray, we're going to send them back to the lab again. But this time we're expecting the lab to bring back wax blocks. So these wax blocks will be fabricated according to the measurements or the model that the lab would have fabricated using the impression that you took with the special tray. So after taking impressions without the special trays, we tell Mr. Martin, bye Mr. Martin, we will see you maybe next week Wednesday, for example, or in 3 days time. So you tell him to leave. Then you still write at every stage, ladies and gentlemen, you as the assistant have to fill out the lab slips. There are examples of lab slips on eTutor. You're going to fill out the lab slips to explain to the lab what you want. So in the first appointment, you are going on your lab slip, you're going to write to the lab technician that we want special trays. When the special trays come back, we took impressions, right? You can write on the lab slip now that we want our wax blocks. So now you send everything back to the lab. Please make sure, ladies and gentlemen, that at every stage you are disinfecting your impressions before you send them to the lab. You would have maybe cleaned them, got rid of any blood or saliva, disinfected them, put them in the appropriate containers such as a plastic container, and then send them off to the lab. Don't just send them off with all the hohaikis on the impressions. Okay, so now we've sent Mr. Martin off. We want wax blocks, right? Okay, now we come to our third appointment. So the third appointment is the bite registration appointment. So Mr. Martin now comes back. Now we have our little wax blocks, right? So the wax blocks are then placed into the patient's mouth. That's when the dentist will decide if the blocks are too high. If they're too high, we'll have to trim the blocks off. If they're too short, the dentist will have to add wax onto the wax blocks. Okay, then jaw relation is marked with a Willis meter. So we're going to check the patient's centric occlusion, centric relation, but I don't want to get into details with that because that's not really your work. But we mark jaw relation using a Willis meter. So we're checking for occlusion, that the patient is biting properly in the position that we want them to bite in. And then excess wax is removed. So if there is excess wax, like the patient can't close with the blocks in their mouth, then we'll obviously have to trim them off, like I mentioned before. So these wax blocks represent the future teeth, and they must be carved correctly. Yes. And then from there, the form and the color of the teeth are determined, so that would be done by the dentist. And then especially with shade, obviously you want to consult with your patient. A lot of them, especially those without teeth, they like going for your very, very white, like spirvet, very white teeth. So you have to encourage them to go for a more natural shade, go for the shade options that have your more yellow hues and greater saturation. So also that's where the patient's eyes, the patient's complexion, things like that then have to be taken into consideration when you guys actually select a shade. So then from there, the middle line, the vermilion border, so here's the vermilion border, that little S curve there, and the mouth corners are marked off. These are marked off actually on the block. So the mouth corners, when they're marked, then the lab guy knows that from here to here is where I have to place my canine. So that's where we mark. The middle line, obviously, you take the middle, not of the patient's mouth, but of the patient's face, so that, yes, the denture must look symmetrical on either side. And then from there, okay, the vermilion border then are marked off. So like your smile line, you see, so you're going to tell your patient to smile, then you're going to mark that, then you're going to go high smile for your incisor length over there. Yes, so those are some of the things you have to do, not you as the assistant, but the dentist have to mark off at this particular appointment. So more than anything, with this appointment, with the wax block, with this third appointment, the most important thing is for you guys to know which equipment and material that you have to get ready for your dentist. Okay, so that would be your wax blocks, that would be your wax knife. Others you'll have to place warm water into your flexible mixing bowl. Others will have to use torches in some practices. Then you'll then get your Willis meter for your dentist to mark the jaw relation, and then even sometimes your Facebook plate, so that you as well as even floss for your dentist to mark the appropriate areas on the wax blocks. Okay, so more than anything, I'd like to emphasize knowing which equipment and material you have to get ready for your dentist. Then once those are done, you're gonna now send the patient off. So we took our measurements, we selected our shade, then we tell Mr. Martin, bye Mr. Martin, we will see you maybe next week Tuesday again. Yes, so this would be for now our fourth appointment. Okay, so the third one, remember guys, more than anything, know the equipment and material that you have to get ready for your dentist. Okay, then from there would be our fourth appointment, so that would be our fitting appointment. So at the lab, basically with our wax blocks, they're going to put them on our articulator to see to keep the patient's mouth and models in position, and then from there, based on your dentist's measurements and your dentist's tooth form and shade, then the lab will choose the appropriate teeth to actually place onto the wax blocks that you guys have measured at the third appointment. So what comes back at the fourth appointment would be a denture but in wax. We haven't acrylized it, it's not like the final product. So with this denture in wax, it basically helps that if there's any problems with shade, with form, with fit, with jaw relation, they can sort of be adjusted before we go off to the final product. So your slide says, okay, the model denture is placed in the mouth with teeth in wax. Ne? So the wax is cooled in cold water so that the body temperature does not change the form. So every time, personally, I like telling a patient to just have a sip of water, and then from there you're going to remove the model denture. You're going to, every time when you check for something, rinse it or run it under a bit of cold water before you put it into the patient's mouth. Make sure these model dentures, don't keep them in the mouth for too long, because it's still wax. Do you get it? It's still wax, so it's susceptible to body temperature, and it may now distort or disform based on the heat that is in the oral cavity. So we have to work very fast, and every time take it to your basin to rinse underwater so that it keeps its shape the way it was when it came from the lab. Okay, and then that's when the necessary adjustments are made if necessary. But if you are happy, then okay, then the patient will probably be happy. The things to look out for is occlusion in the eccentric and functional position. So when the patient is just seated, how are they? When the patient is in action, how are our model dentures? The appearance in terms of facially, as well as the lip, like the lips mustn't be strained, like the patient must be able to just sit in a relaxed state, like, né? So we mustn't be having dentures that cause the lips to open and be strained, or the muscles to strain. You can see even from the chin, you see when it starts, that's when normally you it will be indicative of the patient then or the muscles being under strain as a result of the denture. And then from their speech, we don't want to hear like whistling sounds or excessive S's. That's why then your dentist will ask the patient to say things like 66 and Mississippi, even your R's like rain and your F's. So if the sounds are off, then they will tell your dentist like sort of what is wrong with the patient's denture. So if the patient, for example, says shh, then we know obviously that we have like our jaw relation is too excessive. So now we need to address the vertical dimension, for example, of the denture. But that's not really important to you for now. But those are things that we look for in speech. Then from there, the patient is asked to look at him or herself in the mirror. Small changes on individual teeth are made outside the mouth using the wax. Like I told you guys, we don't want to keep this model denture in the mouth for too long, because trust me, it will distort. Okay, so we ask the patient to see. Normally some of them improve, their wrinkles disappear, or they reduce in number, they're looking very youthful, like they're in their 20s, not on sasa grants, everybody's happy. And then if correct, the denture is returned to the lab for completion. So if you guys have made all your necessary adjustments, either with the flanges or with the teeth or form or guide or midlines, especially with jaw relation, if everything is fine, we send it off back to the lab. And then, okay, still on our fourth appointment, the denture is evaluated for fit, comfort, and stability. And then the appearance is verified. That's where then you will give your patient a mirror, and you guys, like everyone, participates in how it looks aesthetically. And then the retention of the denture setup is checked as the patient verbalizes the F, V, S, and th sounds, swallows, and yawns. Okay, but I think we've covered that already. Yeah, I think, yeah. I was a bit forward. And then from there, occlusion of the denture is checked, and then the lab prescription for the completion of the denture is prepared. So once all of that is fine, the patient sounds fine, the denture appears fine, the orofacial musculature is not strained, we've reduced some wrinkles, then from there we put back our model denture, and then you guys are gonna again write up the lab slip and give the lab guy the appropriate instructions. So if everything is fine, you can then just say fabricate final denture. So now the lab knows that they can actually acrylize this denture so that the patient can get it in the next appointment. So now we say bye to Mr. Martin again. Mr. Martin then leaves, then we come back. Then from there, we tell the patient maybe come back after 3 days. That's now the fifth and the final appointment. So now we take it that there's like no errors, because it's really hard to fix a denture at this stage. Hence, there's so many appointments to make sure that everything is perfect and pashash. So after the smoothness and the surface have been checked, the denture is fitted. Beware of bubbles and roughness, because bubbles and roughness can also be quite plaque retentive. And then the smoothness of surfaces, obviously, yeah, they're aesthetically pleasing, they must not hurt the patient anyway. Then occlusion is tested, small changes are made. So here we normally make use of our blue articulating paper. We will ask the patient to normally bite on it, camera adjustment, bite on it. If there are places that are too high, then we can also trim them off accordingly. And then from there, the patient looks at their appearance in the mirror. Now we're checking for the final product. Tell them cheese, selfies, look in the mirror, are we happy? The patient's happy, we're happy. Then the patient is shown how to place and remove the denture. So normally either the dentist does this, or you as the assistant. So in the maxilla, normally I like telling the patient, so you put both of your index fingers towards the back, like make little hookies, clip it down, then the denture will just come down there. Then the same thing now with your thumbs in the mandible, you lift it up and the denture will lift accordingly. Okay, and then from there you provide detailed instructions in connection with the care of the denture. So I think I'll just go through those a bit later, but the crux of the detailed instructions is you're going to tell the patient, you know, that they need to adjust to the denture. So it's going to take some time to adjust to the denture. So encourage them to please be patient with the denture. Then from there, you're going to tell them about dietary functions, that we're not going to eat anything hard or bony anymore. We're going to cut our food into small, manageable pieces. Then from there, you're going to then tell the patient how to take care of the denture, that we can sit with the denture all day, you can eat with it, you can speak with it, but in the evening you're going to have to put it in a glass of water, and then you have to then brush or maintain your oral mucosa as you did before. So you brush your teeth / surrounding tissues with your toothbrush as well as Colgate. Even encourage them to get a tongue scraper to scrape their tongues off any debris and hohaikis. And then from there, they can use like either check or sunlight to actually wash their denture in the mornings. You also tell them to not sleep with their dentures, otherwise they will get some form of an infection such as oral candida in their mouths. But yeah, that's like the main instructions in connection with the care of the denture. So you tell them to not brush with Colgate, do not brush their denture with Colgate, but actually rinse it out or make use of either like Jig or Sunlight to actually clean the denture. And then from there, or even Milton, others use Milton, and then from there, to not sleep with it, to put it in water, and then brush in the morning before actually placing the denture back into their mouths. Okay, but that's basically the crux of the instructions for a denture. But if there's anything else, I'll probably highlight it now if I can remember, but basically all practices see that. Then appointment 6, at post-delivery, we check mucosa for any pressure areas or sore spots, and then we can schedule a recall appointment. So now you tell the patient to go home, to go feel out the denture, and so on and so forth. If they have any problems, you must encourage them to come back, or rather even set an appointment for after 2 or 3 days or so. If there's any areas that are like pressure spots or are causing discomfort for the patient, then the dentist will have to ease those areas and then polish them accordingly with the polishing burr, and then schedule a recall appointment if necessary. Yes.